Women Doctors Wing, colleagues and friends for our fourth monthly webinar. And I heartily welcome our National President, Dr. Yashoda ma'am.
Thank you.
And our dear members, Sanjana, Anuradha ma'am, and all other dear colleagues, friends. I once again heartily welcome you all. We are trying our level best from IMA KSB Women Doctors Wing to connect all women doctors from all over the state. So on through this platform actually. And I thank our Bidar IMA President and Secretary for helping us to conduct this webinar this time. It is very nice for me to inform you that many new districts of women doctors of IMA Women Doctors Wing are coming forward to give webinars. And today, the webinar is from our Karnataka's topmost district, Bidar. So I welcome Dr. A.C. Lalitama and Dr. Shweta Patil Kunkeli for giving us the webinar. And we are really very thankful to our President Venkatachalapati sir and Honorary Secretary Prasad sir for encouraging us to conduct webinars and other activities through IMA Women Doctors Wing. I heartily welcome you all once again for this fourth monthly webinar of ours. Please kindly, I request Dr. Sanjana to take over the session.
Okay, thank you, ma'am. Ellarigu nanna namaskaralu. So I welcome all respected IMA members, dignitaries and all delegates for today's IMA KSB WDW monthly web talk. So for today's session, we have, as madam said, we have come with the topmost district of our state, that is Bidar. So I thank the Bidar secretary and the president, mainly Dr. Satish Mudubi for helping us to organize this webinar. So next, I just want to give a brief introduction of today's speaker, who is Dr. Shweta Patil Kunikeri. She has finished her MBBS from MR Medical College, Kalburgi, and MD Psychiatry from JSS Medical College, Mysore. Currently, she is working as an assistant professor and an in-charge head of the Department of Psychiatry, BRIMS Bidar, and her special interest is women mental health, and she is actively involved in spreading mental health awareness among general public in Bidar district. I welcome you, Shweta, for this evening webinar. So best wishes for your talk also. Now I welcome our chairperson, who is one of the active IMA member, that is Dr. A.C. Lalitama. She is a senior gynecologist and obstetrician from Bidar district. She has finished both her MBBS and MD DGO from JJM Medical College, Davangere. She has served in Health and Family Welfare Service of Karnataka. She is a past president of IMA Bidar district, maybe in 2017, where she was actively involved in Chalo Belgaum and Chalo Bangalore activities. She is a founder secretary of Obstetric and Gynecology Bidar Society. She is a senior specialist and also a district program officer. She is a consultant now at Shanti Maternity and General Hospital. I welcome you, ma'am. A warm welcome to all the delegates for today's webinar. So today, our speaker, that is Dr. Shweta, will be speaking on women, aging and mental health. So now the platform is for her. Before that, I would like to say thank you for our IMA President, Dr. Venkatachalapati sir, Dr. Honorable Secretary, Dr. S.M. Prasad sir, and our gorgeous President, Dr. Savita ma'am, and ever enthusiastic madam, Anuradha madam, always behind us to conduct the webinar. Madam will be always behind us. And next, our Amma or our guidance or whatever you say, Yashoda ma'am, for helping us in many ways to come through these webinars. So I think Kavita madam is absent today, or she may join late. I welcome her also. With this brief introduction, John, ask Shweta to share the screen. Hello?
Yes, ma'am, I'm sharing the screen.
Okay.
Okay.
Visible? I hope the screen is visible.
Yeah, it is visible.
All right. Shall I begin, ma'am?
Yeah, you can go ahead.
Thank you. Thank you for the nice introduction. Thank you everyone for giving the opportunity to speak on women mental health. As introduced, I'm myself Dr. Shweta. Coming to the topic today, I'll be presenting a brief lecture on aging and women mental health. So to begin with, what is mental health? Mental health, very simple terms, it is a state of well-being in which an individual realizes his or her own abilities and is able to cope up with the normal stresses of life. Okay, so in a very simple terms, I can say mental health is the cognitive, behavioral, and emotional well-being. Like it is all about how people think, feel, and behave. So good mental health doesn't necessarily mean that a person is always happy or laughing or something like that. A person with good mental health, he can experience a range of emotions like from sadness, happiness, anger, excitement, anything in a very healthy manner, I can say. So, to tell you, if you are in a good mental health, you can do such things like you can learn new information productively, you can build strong relationship with other people, you can adapt quickly to the changes around you, and you can experience a range of emotions within a very healthy manner, and you can work and contribute productively to the society at large. So coming to the gender differences, why there is more specific attention given to women mental health, there are a lot of gender differences when it comes to expression of mental disorders. Like the women and men differ not only in their physical attributes, but how the psychological makeup is there. The women vary from men by the way they communicate, they deal with their relationship, they express the feelings, and how they react to stress. A lot of difference exists there. And mental disorders also affect men and women differently. For example, the depression and anxiety, these are very common for among women when it compared to men. And few of the mental health disorders like premenstrual dysphoric disorder, postpartum depression, premenopausal depression, these kind of disorders are very unique to women because of the reproductive life cycle she is undergoing. And when it comes to mental health disorder per se as well, the experience among men and women is entirely different. For example, men who are depressed tend to be more angry and frustrated. So the symptoms vary. And whereas a woman who is experiencing depression tends to have symptoms of, fatigue, feeling weak, feeling sad, and there is lack of motivation. So this kind of difference exists between men and women. So a lot of emphasis, that's why, is given on women mental health. And women, where there is, when it comes to women, there are a lot of special life stages, I can say, wherein she's given in her reproductive health, there are special events which are occurring throughout her life. But these special events at the same time are proven to be a kind of vulnerabilities to the woman. For example, in early childhood, woman, when it comes to a girl child, see, in most of the families, what happens, the birth of a girl child, is it really celebrated? Or sometimes the birth of a girl child is kind of, cursed, I can say. The upbringing also differs when it comes in comparison to her boy siblings. And woman actually is, the girl is expected to behave in a very certain manner. She's not let to go out, she's not let to be outspoken, and she's expected to give up on things for her other brothers. She, even when it comes to the education, providing education to a girl child, The choice of school or English is, and the extent to which she is given education differs, and it with her boy siblings. So this kind of upbringing gives a lot of stress and kind of have a childhood trauma on girl child. At the same time, when you come to adolescence, the bodily changes which are occurring, there are drastic changes which are occurring during adolescence in a girl child. So a girl child may be in not a position to accept these changes very readily. She may express a kind of fear or guilt. Okay, what's happening with me? If she's not educated or made to understand properly, she may be in a state of fear. So the hormones play a very important role here. For example, such a girl child during adolescence, she may experience symptoms like mood swings, marked irritability, anger, a depressed mood, anxiety symptoms, especially during her menstrual cycle. And if these symptoms are, worse enough, hampering her daily activities, we diagnose something called as premenstrual dysphoric disorder, something like that. So all these are very unique to a girl. And when it comes to adulthood, like marriage and profession, see, another vulnerability here is like, the women, they are made to compromise on professional choice because she has a lot of family responsibilities to take care of. She is supposed to be multitasking. She's supposed to be taking multiple roles, taking care of the family, taking care of the in-laws, upbringing of the child is her responsibility, doing the household chores as well as doing work if she is employed. So this kind of stress is very unique to women, and she's often reminded about the biological clock which is ticking. She is expected to give birth to child at a very certain age, so that may be interfering with her professional life course. So these decisions are very difficult for a woman when it comes to her professional and marital life. And sometimes financial independence, even though some of the women are employed and they're earning on their own, some women are expected to give all their salary to the family, and financial independence is a difficult task for women. And sometimes even women is not given importance in making decisions for the family. Their opinion is considered not so important. So these all have a kind of stress among women. So motherhood, again, there will be new responsibilities, new roles to play. If the mother is very young, she will be in a difficult situation to balance her work and family. There will be a feeling of being incomplete in either of the role, like when it comes to professional front or in the personal front, in upbringing of the child, she is always having a sense of being incomplete in either of the role. And if she has a supportive partner, it's well and good, or she may suffer sometimes. So with all these vulnerabilities, when woman enters a stage of menopause, this is the topic specific which we are dealing in detail about. So with this background of vulnerabilities, when she is undergoing menopause, there are a lot of stress factors again. So menopause as such is not a disease. Okay, it's not a pathology at all. It is a normal physiological change which is happening because of aging. So there is a transition here from reproductive life to no more ability to reproduce. So the fertility factor is gone. The experience of menopause varies with individuals. It is not same for all. It cannot be generalized. And the women can experience this menopausal changes for over a period of 10 years sometimes. Usually the time period of menopause is it starts in late 40s and in the early 50s. The common age is between somewhere around 47 to 53 years. it occurs before the age of 40, it is considered as early menopause. And if it occurs after the age of 55 years, it is considered as very late menopause. Okay, so in some women, actually it can be considered to be a positive feeling, like because it leads to the relief from the menstrual pain, which is occurring on a regular basis. And there is also the burden of management of the menstruation is gone, the fear of pregnancy is gone. So few of the women experience it as a very positive feeling. But it has been found with studies that more than 50% of the women experience this as a very unpleasant experience in their lifetime. So when the perimenopause period, so when it comes to menopause, there are perimenopausal period. This period starts somewhere in the mid 30s. Okay, what happens exactly here? There is erratic estrogen secretion. It can drastically vary. So this leads to changes in the cycles. The cycles are longer or more variable, which leads to symptoms of mood swings, headache, night sweats, hot flashes, bloating, depression, insomnia, anxiety. All these symptoms are because of the hormonal variations which are occurring in this time period. The symptoms can vary with individuals, it's not the same for all. Some women experience a lot of disturbance and few experience very few symptoms, especially those women in whom the hormone production changes gradually. They have very few symptoms. But if it is very erratic, then the symptoms are more worse. The transition to menopause is considered when the ovulation completely stops, her menstrual cycles completely stop, and that should last for a period of at least 1 year. So then it is considered as menopause. And during menopause, what happens is the estrogen secretion decreases, and also the type of estrogen which is dominant now is estrone. And this estrone is very weak estrogen, which is 12 times weaker than the actual estradiol, which is the dominant hormone during the premenopausal time. So, and the production of testosterone continues because the ovarian stroma is still existing. So the follicles are disturbed, the stroma is still existing. So the production of testosterone continues. So these hormonal changes indirectly influence the levels of FSH and LH, which leads to vasomotor and temperature irregularities. So this leads to very common symptoms of hot flashes and night sweats. So the hot flashes and night sweat, what exactly happens here is the blood vessels, the surface blood vessels dilate because of the neurotransmitter changes which are occurring as a feedback phenomenon from reduced estrogen levels. The symptoms are like there is a feeling of redness rising from the neck, which crosses over the face. This feeling is very intense, and the person feels intense heating and sweating. This can last for around 5 to 30 minutes. Following that, there is complete recovery from the symptoms. These symptoms in women leads to very uncomfortable and embarrassing situation. So these are one of the very important reasons why person in menopause experience any kind of anxiety or depression. These play a very important role there. And these symptoms occur, as I said, because of the reduced estrogenic levels, which leads to dysregulation or disturbance in the regulation of hypothalamus activity. The trigger factors here for the hot flashes are stress, if any kind of stress, or having a large meal, or hot weather, spicy foods, or substance use such as alcohol, use of caffeine, use of sugar. All these will trigger the hot flashes and worsen the condition of hot flashes and night sweats. Okay, so what about the role of thyroid? Again, thyroid is very much linked to the woman reproductive cycle. And during menopause, as we know, the uptake of iodine decreases to a very large extent. So because of this, there are chances that the women experience symptoms of hypothyroidism here. So the hypothyroidism symptoms, again, they can be overlapping with the symptoms of menopausal symptoms, like symptoms can of weight gain, feeling of bloating, disturbance in sleep. All this, the symptoms can be overlapping with that of menopause. So it is very difficult to assess whether it is because of hypothyroidism or it is per se because of the menopausal changes. But some specific symptoms like hair thinning, if there is depression, there is increased sensitivity to cold. If these symptoms are existing in a woman in a perimenopausal stage, please, then it is mandatory for us to get tested for thyroid, because if we are unable to detect thyroid, the recovery chances for depression and anxiety are less, because it is a very treatable cause for depression. The thyroid replacement will lead to drastic improvement in her mood symptoms. Okay, the sexual desire, even this is a very diverse and complex phenomenon, because the influence of various hormones has a role here. The psychological influences, like, at that stage of life, how her relationship issues are, what kind of stress she is undergoing, and depression per se is more common in menopause. That plays an important role. Poor self-esteem and boring sex life leads to reduced desire for sex in this stage of life. The physiological influences can be like, the testosterone actually is involved with increase in the sexual desire. But at the same time, since the estrogen levels are very low, the physical aspects, that the lubrication of the vagina, the arousal response, the orgasmic response is very less. So it depends on individual. Because of this, the desire for sex is less in among menopausal women. Other than the psychological symptoms, what other symptoms do occur in a menopause? As we know, there can be osteoporosis, there can be cardiovascular disease, increased risk, stress incontinence, which is very embarrassing to the woman, which again leads to anxiety. Testosterone levels are unmasked because of the reduced estrogen levels. So there will be facial hair, there is thinning of the hair, the male pattern baldness, and also the weight gain in a very male, and then, like, the distribution of the fat will be a male pattern with something like that. And there can be muscle loss and reduced stamina, and skin changes do occur because of the reduced estrogen. There will be reduced collagen and elastin. So the signs of aging, like drying, wrinkling, and sagging, this starts occurring. There can be weight gain as well. So these are the other phenomena which are occurring other than the psychological issues which the person with undergoing menopause face. So coming to the mental health per se in menopausal women, what exactly happens? See, depression per se, depressive symptoms differ from depressive disorder. Depressive symptoms is symptoms of depression, like which are not meeting the clinical criteria for depression, may occur. A large number of women experience these kind of depressive symptoms, and there is 2 to 4-fold increase risk of experiencing these symptoms in a menopausal woman. And as such, depressive disorder or the major depressive disorder, that there is increased risk for this as well, the 2-fold increased risk in menopause women. This risk is very independent of prior history of depression, and it occurs even in medically healthy women. Okay, so, and these are very much specific to early during the transition, that is during the perimenopausal period and in the early postmenopause period, and they tend to be relieved once the menopause occurs. In the postmenopausal women in the later stages of life, it tends to be less risk. And more significant number of women experience persistent and recurrent depression if they experience depression during perimenopausal time. So in brief, the criteria for depression, the major symptoms are depressed mood, anhedonia, which is we call loss of interest, and fatigue or loss of energy. These are the major symptoms. If either of these two plus any of the other minor symptoms like change in appetite or sleep, disturbance in sleep, reduced libido, inappropriate guilt, death wishes, suicidal ideas, these symptoms, if they are present, then we call it as a major depressive disorder. Along with the depression, more common mental health disorder which is occurring in women is the anxiety disorder. Anxiety again. So anxiety, the symptoms are again apprehension, restlessness, irritability, being very impatient, being fearful, difficulty in concentration. She has trouble falling asleep, and there is increased muscle tension. There is increased frequency of urination, hyperventilation. Okay, so these are the anxiety symptoms which are occurring in a woman. Okay. So now when we come to the etiology per se for the psychological disturbances which are occurring in women during the perimenopause time, is there is, as we know, estrogen levels are reduced. So the receptors of estrogens are found to be very abundant in areas of brain like amygdala, hippocampus, and hypothalamus. So this plays a very important role in the the neurotransmitter levels. Like estrogen limits the activity of monoamine oxidase, which is involved with the degradation of serotonin. It increases the tryptophan hydroxylase, which is involved with the production of serotonin, and it also makes the reduces the reuptake and indirectly increasing the levels of serotonin at the postsynaptic transmission. Okay, so indirectly this helps in the increased serotonin levels, which is which is helpful for patients with depression. And dopamine, it increases the dopamine beta hydroxylase, which is involved with the conversion of dopamine to noradrenaline. It is also believed to be have a stimulating effect on brain-derived neurotropic factor, which is a neuroprotective agent. So because this estrogen has such a neuroprotective effect, when there is a loss of this estrogen, the woman tends to experience anxiety and depressive symptoms. This is again because of the reduced estrogen level, which will indirectly reduces the level of serotonin and noradrenaline, leading to symptoms of depression and anxiety per se. The psychological stresses, we told about the biochemical component. Now, when we come to psychological stresses, what happens in a menopausal woman is, women at this stage of life may experience lack of social support. So she may be unemployed sometimes. And surgical menopause, it is said that surgical menopause, the women who are undergoing surgical menopause experience very severe symptoms of menopause, and they also are at higher risk of developing depression and anxiety when compared to women with natural menopause. This is because most of the times the oophorectomy is done at a very early age when the woman is undergoing surgical menopause. And at this stage of life, women may be having poor overall health status, like she may be having other non-communicable diseases like diabetes, hypertension, some cardiovascular diseases, which are also playing a very important role, leading to increased stress level among women at this stage of life. The other important aspects are like negative mood, before the menopause, a kind of negative attitudes towards menopause and aging, because youth, being young, is given a lot of importance in our society. So when the woman is experiencing that I am aging, I am no more a young girl, my facial features are changing, she'll kind of face apprehension and has a negative attitudes and develops anxiety towards this aging phenomenon. So again, the substance use like smoking or alcohol, if there is something like that, she is at higher risk of developing the symptoms. Also, because of the various responsibilities, various roles the woman is playing, she has very least very less time to give importance for herself. So most of the women are not at all exercising, or even if they do, they do very little exercise, which is a very important factor in maintaining the overall health of the woman, okay, of any person per se. Sometimes the individual may also experience that she's a single person with no partner because of the divorce or death of the loved ones. This is also a kind of stress in this stage of life of the woman. Again, negative feelings towards partner, if there is something like that, if she is at higher risk of developing symptoms of depression and anxiety, personal stress or any pursued problems can also influence. Other social conditions, other social factors are change in the childbearing role, or there is a loss of fertility. Some women experience as this as a very negative feeling, because she may feel that her womanhood is lost once there is a cessation of reproductive cycle. We call something as empty nest syndrome. This is more commonly found in the Western world, but these days I can see this in the Indian women as well. This is the occurrence when the last child of leaves the home. So at this stage of life, the woman feels very lonely. The child may leave the home for further education, or will settle with a different livelihood, something like that. So this is again very common or very unique phenomenon which is occurring at this stage of life, because she is more attached to her kids and she has a very unique relationship with her children. Okay, and any kind of illness which is occurring to self or others, because she is the primary caregiver most of the times. At this stage of life, she has a responsibility to take care of her aging in-laws as well as her parents, and maybe sometimes she will have grandchildren to take care of. So these are all leading to increased risk in the woman. So changes in employment, for example, at this stage of life, there is an increased responsibility. If the woman is employed, like among doctors, we will be in a stage where we are in 40s, we are given a higher responsibility post, being the director of the institute, being the head of the department, or something like that. When we are given a higher post with higher responsibilities, that is also again a stress inducing, which is adding to the stress, other life stresses. Okay. So other risk factors can be like the woman may be widowed or divorced, structural brain changes which are occurring sometimes because of the cerebrovascular accident which she has undergone, if any, then any major physical or chronic debilitating illness, or previous history. This is important. If there is a previous history of depression in women, then they are likely to have depression again, or substance use again, and certain medications which are centrally acting, or antihypertensives, analgesic steroids, or anti-Parkinsonism drugs, and use of benzodiazepines also have an important role, and they act in a very can induce depression and anxiety. Okay. So why there is a window period? As I said earlier, there is a window period of risk, that is the depression and anxiety are more common in perimenopause or early menopause, not in the late menopause. Why this is so? Because the hormonal variation is occurring. The fluctuation is the hormones is more important than the complete cessation or the complete loss of hormones. This fluctuation is leading to the symptoms per se. And also during this period, the woman is experiencing the vasomotor changes, the hot flashes, the night sweats, which are also influencing her anxiety symptoms. Okay. The overall health, she may recognize that she is having some chronic debilitating illnesses, and The psychological stressors, which we discussed earlier, if they are more, the time relation of the psychological stress is also very important. Like if it is more closer to the occurrence of menopause, then it has a more stressful, because she is already undergoing so many things undergoing at the biological level. Okay, so this is how it is more common during this time period. The other psychiatric disorders, which if she has experienced certain psychiatric disorders in the past, like anything like schizophrenia, obsessive compulsive disorders, which we call as an anxiety disorder, or bipolar mood disorder, they worsen during this period. And it is also noted in some women who have experienced the premenstrual dysphoric disorder in her adolescent period, they are likely to have such symptoms again during this menopausal time. Okay, so that is observed in some of the women, okay, during the transition. And there is another unique condition like trichotillomania, that is hair pulling. It is also seen to worsen or during this period. Okay, so we discussed a lot about the etiological factors for these disorders. Now coming to the treatment aspects. First of all, the hormone replacement therapy, which is thoroughly investigated, and there is a lot of research done in this aspect. So hormone replacement therapy, they say it is very critical to decide the time of when you want to start the hormones. For example, like if the hormone replacement therapy works well when you start this during menopause, early menopause, and within the first 10 years. If you start it at a later stage, then the beneficial effects of this is very less, and in fact you will be worsening the condition if you start later than 10 years. Okay, so the risk of coronary diseases, osteoporosis, dementia is significantly reduced with use of hormone replacement therapy. The goal is to maintain the estrogenic effect. Like, when the time is, when there is a reduction in the estrogen, to maintain that, we need to replace the estrogen. Here, the route of administration also plays a very important role, like either oral or transdermal. And it is said transdermal route is a preferred choice because with the transdermal route, there is very less chances of thromboembolism, which is more common with the oral route of estradiol. So because of thromboembolism, the woman may meet with cerebrovascular accident, okay, if hormone replacement therapy is given through oral route. Hence, the transdermal route is preferred in the woman at this stage. Okay, so other important things like hormone replacement therapy, it actually helps to improve the quality of life because it reduces the symptoms of hot flashes, night sweats, profound fatigue, loss of libido. All these symptoms improve with the hormone replacement therapy. And it also has a beneficial role in treating mild depressive symptoms. Okay, and with hormone replacement therapy, especially when you're giving estrogen, it is said there is no increased risk of breast cancer in such women. Okay, now what is the role of progestin? If progestin is used in patients who undergo natural menopause, like if the uterus is present, then you use progestin because to reduce the risk of endometrial hyperplasia and carcinoma with the unopposed action of estrogen if we are giving HRT. So progestin containing IUDs are more preferred because with the oral progestin, there are systemic side effects which we need to avoid. So medroxyprogesterone acetate is the preferred choice of drug when it comes to progestin class of drugs. With progestin, the adverse effect are it can worsen the depression. There can be symptoms of bloating. There can be increased risk of breast carcinoma. Hence, the minimal effective dose of progestin is preferred. Okay. Okay, and what is the effect of this hormone replacement therapy on psychiatric symptoms per se? There are studies which indicate that estrogen and androgen alone or in combination, they help to relieve the symptoms of depression in non-clinically. I said non-clinically because If clinically depressed, then they need other type of treatment. It improves the quality of life as it affects the symptoms of hot flashes, night sweats, anxiety. All those are relieved, and the effect appears to be greater for perimenopausal symptomatic women, and that and post menopausal women, the effects are very less. Okay. Now, the role of psychotropic drugs, especially the antidepressants. These antidepressants can be used both in patients who are experiencing the depressive symptoms or even those with major depressive disorders, especially because hormone replacement therapy is not uh, chosen by the women, most of them, because of the side effect profile. They are very anxious to take up the HRT treatment most of the time, and hence the role of antidepressants per se becomes very important here. The antidepressants, SSRIs and SNRIs, it is found that no specific drugs like SSRIs, I can give example, escitalopram, fluoxetine, paroxetine, sertraline, SNRIs like desvenlafaxine and duloxetine. These are the drugs which are found to be very useful, but I know individual drug has been found to be very superior to others in this aspect. Okay, these antidepressants are preferred and recommended, especially in women who are experiencing very severe symptoms, severe depressive symptoms. There are multiple depressive episodes in these women. If in the past, if there is significant functional impairment because of the symptoms, and if the person experiences or expresses suicidal ideation, in that case, you need to give antidepressants. Okay. And when it comes to a person with the past history of depression, you need to consider which drug she used in the past and whether there was response with it, because she is going to likely respond to the same drug again this time. Okay, so when you are choosing the drug of antidepressant, you need to consider the symptom profile, the tolerability, the adverse event, and the drug interaction. Because the drug interaction you have to keep in mind at this stage, because she may be having other debilitating illnesses, chronic illnesses for which she is taking medicines. So the drug interaction is also one of the things which you need to take care when you're choosing the antidepressants. Okay. Another important factor which we need to give very much importance is the diet during menopause. See, the very nutritious diets, it helps in relief of fatigue and mood symptoms. So a healthy diet should consist of, it should be low in fat, it should be high in fiber, there should be plenty of fruits and vegetables incorporated. Okay, and whole grain foods are more important. You should avoid any kind of fizzy drinks because they contain phosphorus, which will deplete the calcium levels. You have to reduce the intake of saturated fats, and include legumes like peas, beans, and lentils, which are phytoestrogens are there in this, which are believed to be relieving the symptoms, okay, of in menopause. You also include B complex in your diet, or take supplements, because it's going to help with the stress, hair, and nails. Okay, and ensure you take enough amount of calcium and vitamin D on regular basis. Avoid any kind of substance use, okay, because it's going to worsen the hot flashes. And avoid caffeine because it's going to lead to calcium loss, and avoid refined carbs as well. All right. So a note on phytoestrogens, it's not generally used, but these substances are found in cereals, vegetables, and legumes. Okay, so these are found to be useful in reducing the frequency of hot flashes and night sweats generally. All right. So other important aspect we need to take care at this stage of life is some lifestyle modification we need to incorporate. As I said earlier, exercise is very beneficial with respect to physical as well as mental health. The various benefits with respect to exercise are like, it helps to maintain a very healthy weight. It helps to relieve the hot flashes and mood symptoms. It increases the metabolic rate, the bone density, and muscle and strength. It also improves the lipid profile. So the risk of cardiovascular disease is very minimal when you exercise on a regular basis. It improves the genitourinary problems. It relieves the depression. It induces sleep. Sleep is very important because there is sleep disturbance is occurring a lot in menopause women, and it overall improves the quality of life, which is very important. So other than that, the mind games, the activities which will stimulate your brain, like playing crossword puzzles, reading new books, improving your knowledge, solving mathematical problems. It also helps to improve the memory. So you have to take care of your brain, the memory aspect as well, right? So again, the support from the family, it's very crucial at this stage of life, uh, especially from the spouse. The spouse can plan activities that the couple can do together, like going for a walk, jogging together, exercising together, and that it helps a woman to stay fit as well as feels a reassurance that somebody is with me. Emotional support is very important. Spending quality time with her is very important. Empathizing, see, she is undergoing a very hard time during menopause because of the various changes which are occurring in her body and the stress levels. So if a quality time is spent with her and is empathized with her, then she feels better. That will also indirectly help to improve her mood. And if she's feeling low, don't just put blame on her. No, she's just being a woman, and she's having premenstrual symptoms, something like that. I understand that she's overwhelmed with so many things happening around with her at this stage of life. All right. Again, some important aspects which you need to take care at this stage of life. Sleep hygiene, as I said, sleep is very much disturbed during menopause because of the menopausal symptoms of hot flashes and night sweats. So sleep hygiene is very important here because we tend to avoid giving any kind of medications for sleep. So going to bed and getting up at the same time each day, it will help to maintain your circadian rhythm. Okay, sleep in a very dark and quiet room at a comfortable temperature. Avoid any kind of large meals, exercise, caffeine, and nicotine just before the sleep. Exercise in general is good, but exercising just before going to bed, you tend to, some people tend to have the habit of going for a walk after dinner. So that is not really advisable because again, it will release the dopamine and it will activate your brain. It is not going to help you with sleep. And maintain dim light in the bedroom environment and avoid using any kind of gadgets at this time, especially these days, checking the WhatsApp at late night before going to bed, watching TV on bed, all these kind of activities should be avoided in bed. And 2 hours before going to bed, you should switch off yourself from using any kind of gadgets. You have to take care of your emotional well-being as well. So at this stage of life, bonding with your family, bonding with your friends, participating in various social activities, all this play a very important role in maintaining the overall mental health of a person. So they enjoy conversation, talk to your friends, be happy and contented. And whenever you feel that there is something wrong happening with you, please seek the help of a counselor or a professional psychiatrist, which will be very effective. And spirituality, again, it plays a very important role at this stage of life. It is also found that a person who is spiritually inclined tend to have very less mental health diseases at any stage of life. So doing your prayers regularly, doing meditation, being positive, and living with a hope has a lot of positive effect on your mental health and overall health of a person. Again, the mental well-being, you need to take care. You need be a constant learner. You develop a new hobby, continue working. If you are lazy at this stage, any kind of activity, being active, being productive is going to help you a lot with your self-confidence, with your self-esteem, and it will help you with your mood as well. Reading, improving your knowledge, conversing with people, And very important, learn to love yourself. Don't depend on anybody to take care of you. Yes, you need the social support, you need the family support, yes, but primarily learn to love yourself. Remind yourself that you are the most important person and you are playing a very important role in this life. All right, so this is it. Thank you so much. Thank you for your patience.
Thank you for your
I hope I'm
talk
done.
on aging, women, aging and mental health. So lot of things we have learned from childhood to menopause, more about menopause, I think. So now I request Dr. A.C. Lalitanamma Madam to give few conversation or whatever she has said, to say few words about her and also our IMA.
Dr. Shweta, thank you so much for your such a very elongative and very informative, extensive lecture. In a very short period, you have covered such a vast subject. Really, I appreciate this. This is one of the Indian woman population. It's a very burning issue, burning health issue, starting from the childhood to adolescence. You have covered, and the reproductive age, perimenopausal age, and menopausal age. You have covered everything. Even the hormones you have elaborated in such a way.
Our topic she has covered.
All our gynec topic also she has covered. I really appreciate you.
It's very interlinking, right?
And in a very short period, you have managed to cover everything about your psychiatry, including the hormones, physiology, biochemistry, everything you have covered in that. I really appreciate.
True, ma'am. True.
And you have given such a valuable contribution to the society through this webinar, through the IMA about the mental health issues of the woman. Thank you so much.
Thank you.
Thank you.
I also appreciate. Hello, I thank the IMA organizing committee. First of all, I would like to thank our sir, Dr. Venkatachalapati sir, who is present IMA KSP president, and Dr. S.M. Prasad sir, secretary, and beautiful ladies, Dr. Savita Ramesh, and vice chairman, and also the vice chairman, Dr. Sangeeta Patil. Coming forward to uplift the woman doctors wing that we thought of starting in the year of 2017, I think. We had one meeting at Medicon at Bangalore. So there some of the lady doctors from Tumkur, Hassan, Bellary, we thought of having one separate ladies wing, because there was so much of scarcity in the IMA to have particular positions to be given only for the ladies. That much of scarcity was there. So we thought of having this separate ladies wing. That is suggested Dr. Ravindra sir also. That time he was president of IMA KSP. And the thing is, I am happy with the IMA. Day by day, it is improving so well that IMA is conducting many of the webinars which are very informative during this pandemic. Even the woman wing and the IMA local branches. So I'm so happy with that. And this COVID pandemic, it has made our this online CM is very easy, because it is not that difficult to arrange the things here. And also, one more thing is, I want the participants here in the webinar to. We are poor, very poor in driving this IMA membership drive. As you all know, many of the doctors, even the senior most doctors, are not the members of IMA in most of the places. So what I suggest here, the participants, I request them to mobilize, motivate the doctors, your fellow doctors, colleagues, and the junior upcoming doctors, when they come out of the college. and you make them the members of IMA, and to increase the strength of the IMA, what I feel. And
Thank
IMA
you so much, ma'am.
has taken a good
Thank you
role
so much.
in this pandemic period by giving support to the warriors, and also the difficult situations in some of the hospitals. I really appreciate. So it is the need of the hour to encourage the membership and to make the IMA much strong. And we have to be united to support the IMA and have good strength at local level, state level, and national level. This is very important at this level for our survival of the medical profession itself, because we are observing so many violences and others taking in this critical period. Also in this COVID period, we have come across. So it is the need of the hour to have the doctors more in number. What I suggest.
Thank you, ma'am. Your suggestion will be
Thank you.
taken up. So nice
Yes,
hearing
ma'am.
you
We are
and
working
Shweta
very
from
hard.
Bidar. And we are also working on this topic.
Yes, ma'am.
Our Anuradha madam is working day in and day night on this topic, like uniting everyone
And
to this.
Women Doctors Wing is they are doing very wonderful work. What I feel.
Thank you, ma'am. Thank you. Now I request, now I request everyone to give a sweet smile. So our John has said that he will capture the photos of all the person who have logged in. So please request everyone to give a sweet smile. John, we are ready.
Yeah.
So smile.
Yeah, let everybody come.
Yeah, everybody, I think they won't come. How many of them are there? You click
No.
the photo on there. I request all the person who have logged in to unlock their video and please give a smile. It's like an unlocking our period at the lockdown period, so that we
Yeah.
begin
Good evening.
Lockdown. Yeah.
unlocking our lockdown period. So smile, everyone who have logged in or who is there. I request everyone to give a smile. John, ready, please. Ba smile ಮಾಡೋದು ಆಗೋದಿಲ್ಲ.
Smile ಜಾಸ್ತಿ ಮಾಡಕ್ಕಾಗಲ್ಲ.
Done, ma'am, done.
Done. Thank you.
Thank you so
Thank
much.
you, John. So, at last, a vote of thanks I would like to give the speaker and the chairpersons of the Bidar IMA district, and also to all the dignitaries of IMA and the delegates of IMA who have logged in. And every time and whenever we conduct these seminars, we would like to thank John, Arun, and Anand for making it to run smoothly. And I think in between our president has logged in, Dr. Venkatachalapati
Yeah.
sir. So I thank him for supporting us and making us to do many things. And from the national board, national branch, Kavita, Rajeshri
Yashoda.
Amma, Yashoda Amma, both have joined. So
Yeah.
thank you, ma'am, for logging in and hearing us. I hope the topic was good, and our chairperson has also encouraged many things about IMA. I request everyone, whoever is